It didn't start in a back alley. It started in a doctor's office, with a white coat, a clipboard, and a sentence that changed everything. "This will help with the pain." And just like that, an epidemic was born in the most trusted room in the world. Let's talk about how the opioid crisis began. In the 1990s, pain was rebranded, not as a symptom, but as the fifth vital sign. And with it came a promise: no one should suffer. Not when we had the science to stop it. Enter OxyContin, marketed as a miracle. Time-release formula. Low addiction risk. Safe. Effective. Modern. It was backed by studysome, manipulated, promoted by repsome, incentivized. Approved by the FDA, whose people had ties to the drug makers. Doctors were courted, hospitals were trained, and patients were told, "You won't get hooked, this is different." But it wasn't. Behind the polished brochures and smiling faces, OxyContin was just another powerful opioid. And people got addicted. Fast. Silently. Legally. Let's talk about the scale of deception. Purdue Pharma knew. Internal memos showed it. Whistleblowers warned. But the pills kept flowing because profits were climbing, and pain management had become a business model. By the early 2000s, entire towns were hooked. Prescriptions piled up. Refills stretched endlessly. Teenagers were raiding medicine cabinets. Grandparents were doubling doses. And when the pills ran out, many turned to heroin. Because withdrawal wasn't just discomfort. It was terror. Bone-deep pain. Vomiting. Sweating. Seizures. Hallucinations. Opioids rewire the brain. They hijack dopamine. They suppress breathing. They erase hunger, joy, sex, sleep, until all that remains is the need for more. Let's talk about who got hurt first. It wasn't the rich. It was the rural, the poor, the working class. People with injuries, jobs in manual labor, no access to therapy. They were the perfect market. Desperate, trusting, unprotected. And so the pills were pushed hardest there. This wasn't accidental. It was strategy. The epidemic didn't spread like a virus. It was manufactured, marketed, monetized. And by the time people started dying, it was too late to stop the wave. The pills were everywhere, until they weren't. As lawsuits mounted, regulations tightened. Doctors grew cautious. Pharmacies tracked refills. The tide of prescriptions began to recede. But addiction doesn't disappear with policy. It adapts. It mutates. It finds a new dealer. And the new dealer wasn't wearing a lab coat. It was heroin. Let's talk about what happened when the supply chain shifted. For years, people had been prescribed opioids for everything. Back pain, dental surgery, minor injuries, emotional pain, disguised as physical. And when the pills stopped, their brains were already rewired. They weren't chasing a high. They were avoiding withdrawal, avoiding the agony, avoiding the sickness that gripped them just hours after stopping. So they turned to the streets. And heroin was there. Cheaper, stronger, everywhere. At first, it felt the same. Sometimes even better. Until the doses needed doubling, tripling, until syringes replaced pills, until overdoses became routine. Then came the next evolution. Fentanyl. Let's talk about what fentanyl is. It's not a street drug. It's a synthetic opioid developed for hospital use. In micrograms, measured with precision. But outside sterile rooms, it became something else. A silent killer. 50 times stronger than heroin. Invisible. Unpredictable. In everything. Mixed into heroin. Pressed into fake pills. Hidden in cocaine. Laced into vape pens. People didn't know what they were taking. And they died before they could find out. Let's talk about the role of China and cartel innovation. Illicit fentanyl didn't come from poppy fields. It came from labs. Chemical precursors manufactured in China, shipped to Mexico, refined by cartels, smuggled into the U.S. by the kilo. A few grains can kill. A kilo can kill hundreds of thousands. This wasn't just a drug wave. It was a chemical invasion. Cheap to make, easy to hide, profitable beyond belief. And the cartels learned fast. Why farm poppies when a lab can feed millions of addictions for a fraction of the cost? Let's talk about what fentanyl did to the death rate. Overdoses skyrocketed. At first in forgotten counties, then in suburbs, then everywhere. People died on buses, in bathrooms, at gas stations, in parking lots, alone in bedrooms, needles still in arms, foam at the mouth, phones buzzing from loved ones who never got an answer. Narcan helped when it was there, but fentanyl often killed in seconds. Too fast for help, too quiet for witnesses. Let's talk about the illusion of choice. People say, they knew what they were doing. They chose to get high. They did this to themselves. But many didn't know. They took a pill they thought was Xanax, a powder they thought was safe, a dose they'd taken before, and they died. Not from recklessness. From a system that failed them, abandoned them, and then blamed them. Let's pause. The opioid crisis didn't end when OxyContin was removed. It evolved. It became faster, cheaper, more efficient. It became a pipeline from pain to addiction, to overdose, to death. And no one is too far away to be next. The statistics numb you. 100,000 overdoses in a year. More than car crashes. More than homicides. More than most wars. But behind each number was a name, a laugh, a favorite song, a text left unread. Let's talk about what the opioid crisis actually looks like up close. It looks like a mother waiting by the phone, checking hospitals, calling jails, hoping this time it's just a relapse, not a body. It looks like a child watching their parent nod off at the dinner table, hearing words slurred, smelling something wrong, not understanding why love now feels so cold. It looks like small towns with more funeral homes than schools, with job boards empty, but pharmacies full, with neighborhoods where everyone's lost someone, and no one knows how to grieve anymore. It looks like grandparents raising babies, because their sons and daughters never made it to 30. Let's talk about shame. Addiction isn't just about chemistry. It's about silence. We've built a culture where people don't ask for help, because when they do, they're labeled junkie, loser, criminal, failure. So they hide. They isolate. They pretend. And the voice in their head, already bruised and cruel, becomes unbearable. You're ruining everything. You're hopeless. You deserve this. So they use again. Not to feel good, but to feel nothing. Let's talk about families destroyed from the inside. Addiction isn't a solo disease. It spreads. It turns siblings into strangers, partners into enemies, parents into detectives, children into caretakers. You find needles in the car, lies in the bank account, stolen heirlooms gone for a fix, and every promise to quit makes the next betrayal hurt more. But still, you love them. And that's the cruelest part, because love doesn't cure it, and neither does tough love, or prayer, or punishment. Let's talk about the line between victim and addict, because in this epidemic, it's blurry. Many people were never trying to get high. They were injured, prescribed pills, trusted doctors, trusted systems. They took what they were told was safe, and were never the same again. Others were born into trauma, into chaos, into homes where drugs were survival. where the only calm came from a pill or a powder. Addiction wasn't a choice. It was a symptom of pain no one treated, of wounds no one saw. Let's talk about recovery when it happens. Because sometimes people do come back, but it's not a straight line. It's jail cells, rehabs, relapses, deaths that almost happened, and then maybe clarity. It's rebuilding trust one broken promise at a time. It's learning how to feel again without using. It's carrying guilt heavy enough to drown in, and still showing up. And even then, you're never cured. You're just walking a tightrope. Every day. Forever. Let's pause. The cost of this epidemic isn't just in bodies. It's in futures erased, families shattered, generations wounded. It's in the grief no one talks about, and the love that doesn't know where to go anymore. We call it a crisis. We call it an epidemic. But we rarely call it what it truly is: a system failure. Designed, enabled, profited from, and protected. Let's talk about the machine behind the overdose deaths. It didn't start with one bad pill. It started with a belief that pain is the enemy and medication is the cure. That belief became policy, then industry, then empire. Let's talk about Purdue Pharma. They weren't just selling OxyContin. They were selling certainty. Their reps told doctors it wasn't addictive. They pushed higher doses as more effective. They rewarded top prescribers with bonuses, vacations, prestige. They created pseudoscience, cherry-picked data, paid doctors to publish, funded pain societies, co-opted education. And it worked. Prescriptions exploded. Doctors complied. The FDA approved. No one asked the hard questions, because everyone was making money. Let's talk about regulatory capture. That's when the watchdog becomes the lapdog. When agencies meant to protect the public start protecting the companies they regulate. Former FDA officials joined pharmaceutical boards. Lawmakers received donations. Medical journals took advertising dollars. The lines blurred. And as long as the bodies were quiet and the profits loud, the machine rolled on. Let's talk about what didn't happen. No nationwide education campaign. No investment in mental health services. No systemic trauma care. No real accountability. Instead, they criminalized addiction. They blamed users. They flooded prisons while CEOs walked free. And when fentanyl took over, the system claimed surprise. But they knew. Let's talk about where we are now. Big Pharma pays settlements, not to fix the problem, but to avoid court. Billions in blood money. Tiny fines compared to profits. No one in jail. No real change. Meanwhile, overdoses keep climbing. Because fentanyl is everywhere. Because despair is everywhere. Because trust is gone. Let's talk about why it continues. Because addiction isn't just a personal issue. It's political, economic, cultural. It thrives where people feel unseen. Pain is silenced. Healing is expensive. And profit comes first. Let's talk about the question that haunts this story. Why didn't anyone stop it? The truth? They could have. But it wasn't in their interest. And now, it's too big to bury. Too many dead. Too many complicit. Too many still cashing in. Let's close with this. This isn't just a story about drugs. It's a story about systems that kill quietly. With paperwork. With prescriptions. With silence. It's a story about what happens when institutions sell relief and forget to care who dies from it. But it's also a story about people who survive, who rebuild, who speak, and in their voices, in their refusal to be forgotten, there is something the system never planned for: resistance.